everyone, my name is Michael Orilla, and today I'll be presenting on a comparative analysis of developmental and socioeconomic drivers across nations. To introduce myself, I'm a rising senior at Robinson Secondary School in Northern Virginia, where I'm currently pursuing the Ivy Diploma program. Outside of school, I serve as the Director of STEM for All at the Children's Science Center, where I bring STEM enrichment activities to students across Northern Virginia. This past year, I was a youth advisor for the Virginia Department of Health, where I worked on initiatives to improve adolescent health across the state. And this summer, I'm a research intern at the Johns Hopkins Applied Physics Laboratory, exploring how science and innovation can address global challenges. Looking ahead, I plan to major in healthcare policy and biology, to ultimately pursue medical school, where I plan to be a physician that improves health disparities across the world. Today, I'll be talking about obesity, a global health issue that's often misunderstood, as it is a complex disease shaped by a variety of social, economic, and environmental factors. Obesity is medically defined as an excess accumulation of fat in the body, often measured through BMI, or body mass index, a ratio of height to weight, but BMI barely scratches the surface. Obesity is influenced by genetics, stress, diet, sleep, and lifestyle. But more importantly, all of these are influenced by the environments we live in, which are in turn shaped by a nation's stage of economic development and socioeconomic inequality. Today, 1 in 8 people globally is living with obesity, and the World Health Organization recognizes it as one of the top threats to global health, mainly because it leads to other non-communicable diseases, such as type 2 diabetes, heart disease, and even certain cancers. It also has devastating effects on mental health and self-esteem, and yet this condition is largely preventable. While much of the conversation around obesity has focused on wealthier countries, I wanted to shine light on the rapidly rising rates in developing nations. In this presentation, I'll explore how economic development level and socioeconomic status impact obesity. As someone of Filipino heritage, passionate about medicine and public health policy, I hope to use my research to advocate for healthier, more equitable systems. Let's start by looking at two categories often used in global development: more economically developed countries, MEDCs, and less economically developed countries, LEDCs. MEDCs typically have higher GDP per capita, strong infrastructure, accessible healthcare, and industrialized economies. LEDCs often face underdeveloped infrastructure, limited healthcare, and labor-based workforces. These structural factors directly impact health. For instance, in MEDCs, walkable cities and access to fresh food reduce obesity risk, while the infrastructure in LEDCs makes it difficult to maintain a healthy lifestyle. Healthcare in MEDCs promote regular preventative care to detect and reduce obesity-related conditions early on, while it may be difficult to access healthcare in LEDCs. In MEDCs, jobs are often sedentary, leading to inactivity, while in LEDCs, physical labor remains more common. Now, let's look at specific socioeconomic factors and how they play out in two nations. In this comparison, I selected the United States in MEDC and the Philippines in LEDC. The United States has a GDP per capita of $82,769.41. In a study by Alexandra Lee, clear correlations emerged between socioeconomic status and obesity. Obesity rates are significantly higher among lower income populations, driven by limited access to healthy food and opportunities for exercise. Lower educational attainment is associated with increased obesity prevalence, likely due to reduced health literacy and fewer employment opportunities that support well-being. Rural populations also face higher obesity rates. In fact, 55% of the global rise in BMI can be attributed to increased BMI in rural areas, often lacking proximity to grocery stores, recreational spaces, and healthcare facilities, resulting in the formation of food deserts. Food deserts are areas with limited access to affordable, nutritious food, which can increase the odds of obesity by 30%, even when other variables are held constant. Now, let's look at the Philippines, with a GDP per capita of $3,804.87. In my comparative analysis of two studies, one by Josie Platon Desnacido on Filipino adolescents and another by Charmaine Duante on adults, 4 recurring patterns emerged. In the study of adolescents, the highest wealth quintile were 3.49 times more likely to be obese than those in the lowest. Higher income allows for greater food access, but then it often leads to the overconsumption of ultra-processed foods. In regards to education, families with higher education tend to live in urban areas where unhealthy food is more accessible and physical activity levels are lower due to the built environments that discourage walking. In regards to geographic residence, adults living in urban areas had 1.72 times the odds of being obese compared to rural counterparts, due to lifestyle shifts linked with urbanization. In many Filipino communities, a larger body size has been historically associated with prosperity, which can normalize and even encourage unhealthy weight, making generational change more difficult. What is striking is that these trends are almost inverted compared to the United States. In the US, lower income is linked to higher obesity. In the Philippines, it is often higher income groups that are more at risk. This reinforces the idea that obesity is not a one-dimensional problem. It is deeply contextual and multifactorial. While this challenge is immense, there are several promising avenues for progress. Community-based interventions tailored to local context, such as campaigns for healthy living in schools, neighborhoods, and cultural institutions, can effectively promote healthy lifestyles. As developing countries undergo rapid urbanization, incorporating health-focused infrastructure is essential. Cities should be designed with accessible walking paths, recreational spaces, and grocery access in mind. National governments must adopt stronger regulatory frameworks, including clearer nutritional labeling, limits on junk food marketing, and subsidies for healthy food options. Although systemic change is critical, individual choices still matter. Avoiding ultra-processed foods and embracing active lifestyles can support a healthier weight and overall well-being. And finally, more research, especially in underrepresented regions, is crucial to tailor interventions appropriately and equitably. In conclusion, my research suggests that wealth, geography, and education are key drivers of obesity, particularly in developing countries undergoing rapid social and economic change. In closing, addressing obesity requires not only medical solutions, but systemic change. Whether as clinicians, policymakers, or engaged citizens, our actions, both individual and collective, play a vital role in shaping healthier, more equitable communities for all. These are my references should you want to explore more about obesity for yourself. And again, thank you to the Johns Hopkins Global Health Leaders Conference for giving you the platform to help advocate for issues that are shaping today's changing landscape. This is my contact information, and please feel free to reach out. Thank you.